Hello, this is Anne DeGheest. It's April the 30th, and this is my first video on insights on the epidemiology of the SARS-CoV-19. So 2 videos this week, and they all are very, very interesting, so please don't miss them. The first one, we're going to talk about what's happening internationally. The US is doing fantastic. This is no better word for that. We're going to see there's no more major hotspots. Cases are down 27%. 43% of the population has at least one vaccine dose. But India and South America are absolutely exploding, and there's a lot of lessons to be learned. We're going to see that Europe seems to be stabilizing. In the second video, we're going to talk about the alphabet soup of B117 and E484K, and what does that mean again? So what's the difference between mutation, variants, and strain? We're going to talk about the new CDC mask guidelines. We're going to talk about the fact we have to help the second part of the population to get vaccinated. Right now, we have a demand that's higher, that's lower than the supply. So we have dropped in our vaccination rate. And then I think I'll share with you what's happening on long COVID. We're going to discover that is the real tsunami that is going to hit the US in the coming months. So you don't want to miss this. Okay, let's talk about epidemiology. Southeast Asia is driving world growth. You can see here that the world was going nicely down, driven by the drop in the US. And unfortunately, Northeast, not just India, you're going to see the whole Southeast Asia there is unfortunately going up, as well as Brazil. Europe is going down. So let's take a look and see the lessons we can learn. Why do we spend time? And you're going to see in this video, I'm going to spend a bit more time than normal on international, because we can learn a lot about what's happening and hopefully avoid some of the problems that's happening in other countries. So, we need to look at this like the canary in the mine. And right now in the world, we're on a race about vaccination versus giving an opportunity for the virus to mutate and come back and haunt us by avoiding the antibodies of the vaccine. The big worry right now is this boomerang risk that we have in the Southern Hemisphere or other countries outside the US, an opportunity for the virus to mutate and to evade the antibodies, the vaccines we have done in the US. And the Southern Hemisphere is entering their winter. And unfortunately, a big part of the Southern Hemisphere has very high HIV autoimmune compromise, which is the perfect situation for the variants to mutate. I'm going to show you again that the virus can travel very quickly. India basically announced in March they had won the race against COVID, and literally 2 months later, it's a catastrophe. So we don't want to be complacent there. The virus can come back and haunt us in a period of 2 to 3 months. So let's look at the number in the world, 150 million cases. US is still at number 1, but you can see at 32 million cases there, but India is catching up really fast, followed by Brazil. On a worldwide basis, we're growing at 12% on every 2 weeks. So that's still a very steep climb. You can see that climb here is still, unfortunately, the highest ever we have ever been on the new cases reported on a daily basis, which is around 900,000 cases per day. And you can really see in this graphic here that this purple color there, which is the Southeast Asia part of the world, is driving the drive back up of the worldwide cases, while Europe and the US are stabilizing. And it's not just India. We're going to show you that this whole Southeast Asia is exploding, but also we're having a big problem in South America. Remember, we're entering the winter period for them. Uruguay, Argentina, and Brazil are all having really big problems. So let's take a look. India is just on a rocket ship. There's no other words to explain that. There's 349,000 cases. I think today I just saw it was 386,000 cases on April 29. And that's just blowing everything out of proportion. I mean, with the US, we had number 1 in the world at 250,000 cases during the winter surge. I mean, this is going to continue to explode in the coming weeks. And you can see it's basically dropping really far to number 2, which is now Brazil. And the US, great news, we've dropped from 75,000 a few weeks ago to 52,000. So you're going to see the US is doing great. So global heat map, we have problems there, India and Brazil. You can see the darker color. So it is not getting better there. Compare this to the UK. Now, we made fun of the UK when they decided they're going to use all their doses of AstraZeneca to just give a first dose and delay the second dose by 3 months. Well, long and behold, it worked. I mean, you can really see the massive drop, that kind of yellowish color there when they had that peak in the winter surge with the B117 there. So you're going to see the constant theme there that vaccine does work. It is a race on vaccinating as many people in the world as we can before the virus mutates. So let's look at the mortality rate. The US, unfortunately, is still leading the world with around 550,000 deaths. Brazil is very close behind us, 400,000 deaths. And India, although they're exploding there, I'll show you more details, is around 200,000 deaths. Probably will pass Mexico in the coming week. On a daily basis, you can see now we have 14,000 deaths on a daily basis worldwide, but that's being driven by India and Asia. And these are the confirmed case. And you're going to see that the real numbers are much higher than that. So let's look at Southeast Asia. It's not just India, it's Nepal, it's Sri Lanka, it's Thailand. It's this whole area there has just exploded by a growth over a 5 to 6x in the last months. And unfortunately, it's a very high density population there. So the virus has a lot of room to grow. So to give you a perspective there, right now, India is around 39% of the worldwide cases. I just sit there. I mean, that's just astonishing. They used to be around 2% in January. You can see it was pretty flat. This is when they declared that they won the war. And that's why we cannot be complacent there, because literally get these new variants, which is called the B167s, and the thing exploded in a matter of 2 months. And the variants they have is, and I'll talk in my second video about what does this alphabet soup means, but they have one variant that's increased the transmissibility, i.e. it's more infectious, and they have another one that it seems to be evading antibodies, which means people who are infected are getting reinfected, or people who have a less effective vaccines, unfortunately, are getting sick. But look at the numbers there, 18% of the deaths, and these are still on the very steep growth there. So these numbers are going to get worse. So what's going on in India? So in red is this B167. It was detected not long ago. It was detected in October, but you can see the explosion really happened in the last 2 months there. It's absolutely explosive in the percent of the cases in India that have basically taken over the population there. And the problem is that these two mutations are evading antibodies. So the effectiveness of the therapies we have in hospitals, as well as some of the vaccines, are not really working. So vaccinated people are getting infected, and that's being reported by healthcare workers in hospitals. And that's a big worry, because we don't want that problem coming into the US. I think it's a tragedy. It's the only word I can explain it. They've now beaten the world record on the average. They've been for the last week at over 350,000 cases on the average. Today was 386,000. A survey of serology showed that it's underreported by a factor of 20 to 30x. So we may have over 1 million cases, if I'm conservative, and maybe even higher than that on a daily basis. The death toll right now is confirmed at 3,500 per day. In reality, only 22% of all registered fatalities get a certificate by a doctor. So we may be underestimating this number by a factor of 5x. So I think in reality, they probably passed the US in number of cases and mortality rate, and are just on an explosion curve. Most people are dying at home. We also know from a positivity rate that we're under testing, because the positivity rate is over 20%. And historically, remember, the World Health Organization has a target of 5%. And it's so bad there that all the hospitals are full there. So they are taking train cars and modifying them as hospitals for COVID patients there. And right now, today, a couple of hours ago, the US government has officially announced that starting next week, they're going to restrict travel from India. They're trying to minimize the 10 flights per day of people coming to India, bringing in the variants into the US. And it's a long list of other countries that have banned India there. So India is being isolated there because people are trying to stop the spread of this virus, which is clearly very dangerous. So what are the lessons we can learn from India? They had that double mutant variants there, and it had a really, really quick impact. As I showed you earlier, it's a couple of months. They opened way too early. They announced that they defeated COVID at the end of February, early March. And you can see how it went from 2% to 30% of the cases in the world in a matter of a couple of months. So there was complacency that they thought they had control it. As a result of that, they had massive super events. There was a cricket competition in a stadium with over 50,000 people there, and people mostly not wearing masks. There was a political election rallies there where people were like, shoulder to shoulder without good protection there. And then there was a massive Hindu festival with millions of pilgrims. Just use a picture of it. And you can see how these super events, it was very easy to spread the disease. And so the surge, to give the magnitude of it, was a factor of 30x between February and April. I mean, this is the magnitude of these variants. We cannot be complacent there. This could come back into the US. We need to be careful there. As a result of that, I'm sure you saw in the press these horrendous pictures, hospitals being full, patients, not being able to get any help, literally dying outside the hospitals there. They can't find enough oxygen. It's a disaster there. And the other upcoming disaster is that India is the leading manufacturer of vaccine. And Africa was depending on India. And India has stopped the shipment of their vaccine to the COVAX, which is the association of poor countries there who have access to this vaccine, because of course they're trying to reroute it to their population there. So you're going to see a domino effect of what's going on to India as well as in the Southeast. The other problem of India is that they are one of the worst, even worse than the US, in the percent of the tests that they do the genomics. To give you an idea, Iceland, 79% of the tests they do genomics. The UK, which is probably the best in Europe, is around 8.7%. US is 1%, and there's been the Biden administration has dedicated $300 million to increase that number because we're very blind in knowing the genomics. So if this mutation coming to the US, we don't know. In India, you can see is very blind also. So the number we're seeing are probably worse than the one I've shared with you. To give you an idea, there was an international flight on April the 3rd between New Delhi and Hong Kong. And it created a COVID cluster. Now, Hong Kong is very strict. So they had 21 days quarantine. So they put the whole flight into quarantine. A third of the flight developed COVID. And I think it's important to understand that because every passenger had to have a negative COVID test within 72 hours before taking the flight. But I've explained in the past that depending when you take your PCR test, you may have a false negative. And you can very easily have been infected, do the test right away, not having enough virus to be tested. And then you go at full infection risk 3 or 4 days later in the plane, then you infect the whole plane there. So as a result of that, Hong Kong has pretty much banned the flights from India. And so you need to be aware that, there was a drop in the infection rate when the airlines were blocking the middle seat. And you can see there was decreasing the risk significantly by from 23% to 57% was a major drop. Unfortunately, now most of these seats are being filled up again in the US. And then it's all about the ventilation. The airplane are doing a good job in the ventilation there, but you still have your respiratory particles from the people around you there. And of course, the risk of the airports. So China now is afraid of an outbreak due to the Indian strain that has entered China. There was a boat that came from India into Hong Kong, and 11 of the 20 crew members ended up being infected there. So there's a big concern in China right now because starting tomorrow on May the 1st, they expect a record 200 million travelers within China to celebrate what's called their China Labor Days. And so the big worry is that this is a super spreading event that may spread these new variants within China there. So let's keep posted the next few weeks to see what happens. Let's talk about South America. Unfortunately, that part of the world is also in trouble. Uruguay, which is a small country in the southern part of South America, there is having a huge surge there, even higher than Argentina and Brazil and Chile that we've been talking in the past. Mexico is still doing great, so hopefully their data is accurate. So what's happening? It's the variant again. If I have a common theme here, the variance is what we need to control. So the Brazil P1 variant is in 30 countries. It's over two times more contagious. And has a higher reinfection rate, 61% reinfection rate, i.e. if you have antibodies, you may still get it. There's a population in Manaus, which is in central of the Amazon, where over 60% of the population had the COVID, and they're all getting reinfected. There is pretty much 100 Brazilians dying every hour. They have a very small vaccination rate, and so therefore they don't have protection. Uruguay have 75% of the infection is that P1 variant from Brazil. And it has been shown that the big vaccine in South America is from China. It's from a company called Sinovac, called Coronavac. And it's only 15% effective after the first dose. So a lot of people have a full sense of security, and they figure after they get the first dose, they are fine. And unfortunately, they get infected. In Peru, April was the highest, the deadliest month they've ever had. And for example, in Lima, which is the capital of Peru, the P1 again is 40% of infection rate. And now you're having a new strain that's coming out of Peru. This is what we don't want. You see that the new is a C, that means it's this new strain, A, B, and C. I'll explain this in the second video. And unfortunately, that strain is now spreading in Argentina, Chile, and Ecuador, and maybe coming back here. So Colombia has 90% of the hospital ICU at full capacity there. And a study from Chile showed that overall the effectiveness of Sinovac is only 67% after the 2 weeks after the second dose. And it only prevents death by 80%. Now we know that mRNA, prevent death by close to 100%. So the problem is that they're having a lower quality vaccine, and it's showing in the outbreaks. So let's look at Brazil. They have over 400,000 deaths. You can see it went down a little bit there, but it's not exactly, there's a bit of an uptick, so we have to keep an eye on that. They have over 3,000 daily deaths. They call this the biological Fukushima. It's totally out of control. It's kind of a tragedy there. Part of that was a leadership issue there from the president, who thought this was a little bit of a little flu, and he pushed hydroxychloroquine, which gave a false feeling of safety there. So people are not really making a lot of efforts in protecting themselves. And so vaccination rate is only 19% for one dose. So you still have 81% of the population. That's a reservoir for the virus to spread. So let's look at Europe. Good news, you can see Europe is following the same pattern than the US. The kind of, still we want them to be below here. We want them to be in the low rate there, but at least it's going in the right direction there on the number of cases per million. So it's normalized data. This is an interesting graphic that shows that you can see Sweden and Poland and the Netherlands, which are the three countries that had a bit of a more open policy there, have the highest rate. And to give you an idea, you can see Sweden there. They've only at the 30% of the population that has one dose, and 9% had two doses. Poland has a similar type of track records there. And you can compare this to Britain, who really went all out to getting the first dose, and that really worked. I mean, look at that. They barely have an incidence there. So again, vaccine, giving it to as many people as possible. In this case, it was the AstraZeneca, really worked. And compare Finland and Norway, which are very similar population next to Sweden there, and the difference in the amount of outbreaks there. So again, it's really not only vaccination, but also the policy of the leadership of those countries. So lessons learned. Let's take a look at a couple of countries here. You can see Poland was having this huge surge, if the highest ever, and they went into full lockdown. And you can see lockdown does work, in the gray shade of the lockdown area. France, same things. You may have heard that they went into lockdown over Easter, and they're having some control of it, but they haven't fully gone to as low as they want it to be. Belgium, had a bit of a surge there, but they did again a sharp lockdown, and that seems to have brought things under control. Italy is kind of still trying to bring it downwards, but hasn't fully gone below that mid-level there. If you look at other countries like Germany is having an outsurge. They haven't done lockdown there, so they probably politically have to deal with that. And Sweden there, which is a country historically had more this open attitude there, you can see are having a very major surge again. And we just explained that they have a low vaccination rate compared to the rest of Europe. So on a worldwide basis, it's astonishing. In the last few months, we have vaccinated over 1 billion doses. That is such an amazing word by the world. It's just astonishing what the pharma and biotech industry have accomplished there. Israel has, this is the cumulative dose by 100 residents. And the reason why it's over 100%, because in certain type of vaccine, you need 2 doses. But you can see the US has had one of the steepest curve, and is pretty much neck to neck now with the UK. European Union is following way behind. You can see a big difference between the continent and the UK. So on a global basis there, China now has vaccinated over 253 million doses. You know, they have a much bigger population there, so it's a smaller percentage than the US. And you can see that on a worldwide basis, Asia, you know, is where you have a lot of the vaccination. Of course, China leading that, and the US in North America. So percent of vaccination is a bit all over the map. So the US has done an amazing job to have now 30% of the population fully vaccinated, 43% partially vaccinated there. And remember, the mRNA is much more effective than the AstraZeneca, the Chinese vaccine there. But then you can see the European Union is really dropping down, you know, is at 8% fully vaccinated. That's why you still have this upsurge in some countries there. France, which has a lot of anti-vaxxers, is at 9%. And this is the two problem country we talked about. India is 2% of the population is fully vaccinated, 9% has one dose, and Brazil is 6%. And that is why we're having these outbreaks there. There's we don't have enough way to absorb the virus in the population with the antibodies from the vaccine. So that's the risk we're doing on a worldwide basis. It's not just the US. You know, we have to understand we have to vaccinate the rest of the world. So North America is clearly the leader. I have probably much around 45% of the population between us and Canada have a vaccination there. Europe is around 29%. And you can see Asia, a long way to go. And Africa, you know, for some reason hasn't had an outbreak there. Big difference between advanced economies, US and UK leading the charge, versus emerging countries. And this is a dilemma there that we're going to face in the next several months. Mutants and mutation will emerge from those countries there, and they will come back. And that is what we need to be aware. We have to help other countries. The Biden administration has just announced they're going to be lending AstraZeneca and Pfizer doses to Mexico and other countries because we have to deal with this part of the world. So to give an idea, if you look at countries that have high vaccination rate, like the US and the UK and Israel, you can see they really are controlling the infection rate. Now I compare this to countries that have a low vaccination rate, like India, South America, and France, and you can see India, which is, you know, a very 2%, you know, versus 8% in France. You can really see that they're having a problem controlling the virus mutations. So let's look at the US. This is the best news in the last year. We are down 27%. Remember, a couple of weeks ago with 75,000 cases. Now with 51,000 cases. As a result of that, hospitalization death rate are dropping. Vaccination are the drivers. 43% have at least one dose. So it's really having a huge impact. It is working. And we just need to get these numbers to be higher. Michigan is still a bit of a hot spot, and Florida and some of the Northeast area there. But let's take a look. You can see Michigan is going down. We'll do a deeper dive in a few minutes there. A tiny bit of rise in Colorado, but overall the country, you know, is doing much better than it has ever done there. So we clearly are starting to control the virus. If you look at the regional hotspot, you know, we went crazy during the winter surge, but, you know, still have Michigan, Colorado, Minnesota, and Pennsylvania that have a bit of an uptick that they need to control those areas there. Let's look at Michigan. Even the worst place, which is Michigan, dropped by 41%. I mean, no, they were in bad trouble 2 weeks ago there, but you can see they've done a really good job. And of course, they really have done a good job also speeding up the vaccination there. You can see this in the hospitalization across the country. We have this beautiful green color we haven't seen in a long time, and except a tiny bit in Michigan there. So we're going in the right direction as a country. New Jersey, same thing. Remember, New Jersey was pretty high up like 2 weeks ago. We're very aware of what it was going, and as well as New York. And both of them have dropped minus 36% from New Jersey. Very high vaccination rate. Same thing for New York, dropped 43%. So these are all in the purple color. All that is gone. We all have this lower level color. So these are all great news. And you can see that in the community transmission there, very low in the green. We still have problems. You know, you have to be careful when you're traveling in basically Florida, Pennsylvania, Michigan. You still have high virus in the community. So you have to protect yourself if you travel to those areas. As a result of that, the number of cases that are children cases have gone up just because we have less adult cases. And so these are the absolute number of cases. You can see it's rising a little bit there because we're reopening the school, but as a percentage has gone up. That's because the adults have dropped so much. So we still don't assume that the children are invincible there. They can still get sick. We also have dropped drastically the number of tests. And so the question that people are asking themselves, are we getting blind because we don't do enough testing? And remember, it's the test for the positivity, but also we need to do the genomics so we can identify these variants coming from overseas, so we can isolate those patients very quickly there. So we have a risk here that we need to deal with. The good news, the positivity rate, except in Michigan and in Puerto Rico, is pretty much in the green zone, i.e. it's 3% and less, which is what we're looking for. So the contamination, has dropped quite a bit. And part of that is the vaccination. You can see Pfizer is leading the charge in a number of cases. J&J had a hold. I'm sure you saw in the press there. Now they're starting to reemerge there, but we have fully vaccinated 69% of the population over the age of 65 and 43% of the population. So these are amazing numbers. 240 million doses have been given. We right now are in a situation there where you're going to see the number of vaccinations has dropped just because the demand has dropped versus the supply. You can see that we peak at 3.5 million doses. I think we had to peak at 4 million doses, and now we're 2.5. And now we have to deal, and I will talk about this in a second video, about the vaccine hesitancy, because we have to get the herd immunity up. So this is the hesitation rate. This is an interesting analysis there done by the HHS, the government, about what part of the country are uncomfortable at being vaccinated. And you can see it's in that northern part of the US and then the southeast that we have a lot of hesitancy. And there's also an issue there about the availability based on race, and people are most vulnerable. People are the least vulnerable there, which is usually the white Caucasian men. You can see have an overall vaccination rate over 32%, where the most vulnerable there have vaccination rate probably around 26, 27% there. So we as a country are really working in accessing people who have a harder access to vaccination. So the government now has really opened this up to all the pharmacies. So pretty much 95% of Americans are within 5 miles of a vaccination rate, a vaccination location like a CVS or Walgreens. Whoops. So California, I'm going to go very quickly there because it's as good of a picture. It's probably one of the best states. You can see that the number of cases are pretty much the lowest they have ever been. Death rate as a result of that is the same. Positivity rate is 1.3%, which is probably one of the lowest in the country. So I know we're having a recall of the governor, but from my point of view, he has done a very good job. And so there may be other issues I'm not on top of. And you can see the transmission rate, the very big dark red is what you worry about. And you can see that the transmission in the community has dropped drastically there. And so that's a massive, massive improvement. So unfortunately, COVID has hurt other type of disease we're fighting against. So for example, tuberculosis. We are doing a lot of undetected and untreated cases because people were afraid to see their doctors and their patient. So the vaccination campaign we're doing on a worldwide basis, as well as the US, have dropped drastically. That's high 50 to 90% there. You have this massive drop. The same thing for measles. And so that is something that's going to boomerang in the coming years, because you may have some reemergence of some of these diseases there, as we have drastically dropped the vaccination rate. You can see by as much as 50% in some countries. Some good news is that the suicide rate dropped versus 2019 by 11%. Now, a lot of people have anxieties and mental disease, but you can see it depends on the country there. So some country like Russia and Croatia at a slightly higher rate, but other countries like the US, have dropped there. So it surprised a lot of people there, but it's a lot of socioeconomic factors. Also, a lot of those countries provided help to people who lost their jobs, like in Europe and the US. As you all know, COVID had an impact on our lifestyle. I don't know if you have the same size of pants, but since we all know if sweatpants, you probably don't know the difference. But pretty much 68% of us are snacking more, we're cooking more at home, we're ordering less food, and we're exercising less by a factor of 54%. So on the average, we have gained 5 pounds. Some of us may be 10 pounds. I want to ask you who you are. And so don't feel bad because you are the same as everybody else. We're all in trouble. And the other thing I need you to be aware is that the insurance industry very quietly has started waiving up all the waivers they had for COVID. And so when the pandemic hit last year, they basically took away all the deductible and the copay. And that was a big deal because, you know, if you end up in a hospital, you could end up with a quite significant 5 to 10, 20,000 bills, you know, depending what your out of pay and maximum was. And the federal law basically also had required that you could not charge for testing and vaccination. What is happening is that under the law of the ACA, an insurer could basically not spend had to spend at least 80% of your premium in direct healthcare, you know, i.e. reimbursing you for medical expense. What happened during COVID is that most people canceled elective surgery. So most of these insurance companies have spent less than 80%. So you're going to get $2 billion of rebate that are going to come back. And one of the reasons why they're waiving all this deductible, because they knew they were going to have to pay back in some form or shape. But be aware that most of the major plans like Anthem, United Health, and Aetna are now starting to charge for copay and deductibles if you get COVID. So we're going to be moving to a monthly update. So the next time I'll see you will be May the 28th, and then it's going to be June the 25th or July 30th. So pretty much every last Friday of every month is going to see you. You don't want to miss my next video because I'm going to spend quite a bit of time explaining what is happening with long COVID and why that's the real risk and why we need to help the rest of the population to get vaccinated. So see you in a month. Stay healthy and get vaccinated.